Hi, my name is Christine Rayfield, and this is my return demonstration for the insertion of the indwelling catheter for NR224. Good evening, Mrs. Smith. How are you doing? Good. My name is Chrissy. I'm going to be your nurse this evening, and first I would like to identify yourself using your name and date of birth, checking your bracelet. All right, wonderful. So I am here because your doctor put in an order to have a catheter inserted, a urinary catheter. So before we do start that, I just want to ask you a few questions. Are you allergic to latex? Are you allergic to shellfish? Are you allergic to chlorhexidine? And are you allergic to iodine? All right, wonderful. So I'm just going to close this door and then pull this curtain to have some privacy. And then I'm going to perform hand hygiene. And I'm going to assess your bladder for distension, and I'm not seeing any bladder distension. I also want to assess your perineal area for redness, rash, open sores, or skin breakdown, and I'm not seeing any there either, so that is good. I'm going to go over the procedure. So we are going to insert the urinary catheter into your urethra, and that is going to stay in place by a balloon that is filled with fluid. So it's going to stay there until your doctor puts in an order for the removal of it. I'm not sure how long that'll be. It just kind of depends on the progression of your body and the way that it progresses. But before I do insert the catheter, I'll make sure that I clean the perineal area and dry it as well. And then whenever it is time to remove it, we will release that fluid out of the balloon, and then we'll remove the catheter at that time. Do you have any questions about the procedure? And do I have your verbal consent? All right, I'm going to make sure that the level of the bed is the level of my hips, and then I'm going to lay my patient back into supine position. So I'm going to lay you back, and then let me know if you're feeling any discomfort any time, and we can try and make it more comfortable for you. So I'm going to have you bend your knees and put your ankles up to as close to your butt as you can, and then I'm going to have you lower your knees outward, lay them down. Perfect. Okay. So I'm going to perform hand hygiene again, and I'm going to open up my kit. I'm going to use this as a trash bag. Get rid of that. And then when I open my kit, I'm going to open away from me, side to side, and then towards me. I'm going to put this underneath the perineum. And I'm going to don sterile gloves. My right hand is my dominant hand, so that is what I will use to stay sterile throughout the procedure. Get rid of that. I'm going to put this antiseptic solution on top of my cotton rolls. Discard that. Put the lubricant into my tray for the insertion of the catheter, and then get rid of the syringe. And then I'm also going to hook up the fluid that goes into the balloon up to the balloon port, which is right here. So I would screw that in, but I'm not going to do that. I'm just going to pretend. And then I'll remove the plastic from the catheter. And then discard of that. Okay, so I'm going to move this closer. All right, so I'm going to start cleaning the perineal area, so you're going to feel me touch you. Okay, I'm going to put the catheter into the lubricant. All right, Mrs. Smith, I'm gonna have you bear down and you're gonna feel some pressure. So I insert the catheter until I see urine, and I see that now, so I'm gonna put it in an additional 1 to 2 inches. And I'm gonna hold it with my left hand, and then I will put the fluid into the balloon and then remove the syringe holding the plunger in place, and then get rid of the syringe. And then I'm gonna just test to make sure that it's in place by gently tugging, and it is. So then I can get rid of all of this. And then I can remove my sterile gloves. Raise up the side rail, perform hand hygiene. Put on my clean gloves. All right, and then at this time I would tape the catheter to the inner thigh of the patient, and then I would hang the bag below the bladder and then hang it onto something stationary like the bed leg. So I would hang it down here. And then I would also make sure that I thoroughly cleaned and dried the perineal area at that time. Okay. So then I'm gonna go ahead to the removal portion now. All right, Mrs. Smith, your doctor put in the order for the removal of your catheter. I know that we talked about the procedure whenever we inserted it, but I wanted to make sure that you didn't have any questions about the procedure today. All right, wonderful. So before we get started, I'm gonna put you back in that supine position, lay you down, and then have you put your knees back up. Yeah, perfect, just like that, same way. All right, and then first thing, I'm gonna expose you now. So you're gonna lift your gown. I'm gonna inspect for redness, rash, and then sores or any kind of signs of infection. I don't see any. So then I'll remove the tape from the patient's leg, and then I would take that syringe and hook it up to the balloon and release that fluid from the balloon inside. So I'm doing that. All right, so I'm gonna have you take a deep breath in and then slowly exhale as I remove this. All right, and then I'm going to check to make sure that I don't see blood or mucus or any sign of infection on the catheter, and I do not. So I'm gonna put that in the towel and I would wrap it up. And then I would take my gloves off at this time, perform hand hygiene, and don new clean gloves. So we're gonna say these are new clean gloves. Okay, so now what I would do is I would take the catheter bag, or the bag, and I would empty it into a graduated cylinder to measure the urine. And then I would discard of the bag into a biohazard, and then discard of the urine properly. So get rid of that. This. Take off my gloves. Perform hand hygiene. All right, and then I would lift up the side rail, put it down to the lowest position. Wheels are locked, and then I would make sure that you have the call light within reach. Do you have any questions, or is there anything I can do for you, Mrs. Smith, before we leave? All right, wonderful, thank you. And I would perform hand hygiene as I left the room.